Hello, this is Dr. Scott Christie from Oakville Opta Clinic upstairs in the Cheerleading All-Star facility. I just wanted to put a couple of videos together because we get a lot of questions about concussions and baseline testing here. So we're going to do a few videos where we describe what a concussion is, what's the point of doing the baselines, because I get a lot of questions about, you hear on the media that it's not worth it, but I want to make sure everybody understands so that we're all on the same page when we do this. So we're going to go through today and talk about what is a concussion. I'm going to introduce Ryan. Ryan, you can just talk about yourself a little bit.
Yeah, so my name is Ryan. I'll be the sports performance manager here at Opta Health. I'm currently a master's student, slated to graduate at the end of the summer. And I'll be responsible for performing a lot of sports assessments, as well as managing a lot of concussion cases that come through this clinic. I have a big background in psychology, neuroscience, and kinesiology, all relating towards concussions and how they affect an athlete, which is why I'm very passionate about being here with Opta Health to manage those concussions. So I think what we wanted to start off with today was, what is a concussion? So a concussion is not an injury that occurs from direct impact to the head, like a lot of people think. A concussion actually happens when your head moves or changes directions very quickly, which is why when you fall and hit your head on the ground, that can cause a concussion because your brain is all of a sudden stopping inside your head. And this happens because the brain is getting an enormous strain on it. So just a couple things to keep in mind is that only about 10% of all concussions create a loss of consciousness. So 90% you will not lose consciousness. So that's something to be very aware of. Just because you get hit in the head and you don't lose consciousness, it doesn't mean you have a concussion. So Scott, if you want to go over what happens in your brain when you get a concussion.
Okay, so I just have a board here just because this is one of the big discussions I have with a lot of patients that come in right off the bat, because I think the most important thing with concussions, it's not that I don't care about the concussions, they're not that scary if you really know kind of what's gone on. So I'm just going to use this board here, and you'll have to forgive me for my art skills. I'm not an artist at all, but this right here is a nerve. So from the beginning to the end, and in this, there's about 80 billion nerves within the brain itself. So when Ryan's talking about the concussion and the brain moving back and forth in the skull, we're not really concerned about that. No imaging studies ever show that there's a bruised brain. What we tend to see is that these nerves actually get stretched. And I'm not going to go on to a big, huge explanation into this, but I do want you to understand that all these nerves, they have chemicals inside the nerve and outside the nerve. And the inside of the nerve, I've just kind of written down here that the inside of the nerve is negative and the outside is positive. And that's kind of how it rests. So when you want to have a conversation with somebody, the inside of the nerve actually becomes more positive and it starts to fire so that you can actually talk to the person beside you. What happened, and this goes in a particular pattern so that you can actually do this skill. When you're talking about a concussion, you stretch this nerve. There's little doorways that are supposed to stop these chemicals from traveling in and out. But as soon as these doorways are open, a whole bunch of chemicals will go in, a whole bunch of chemicals go out. The inside of the nerve becomes more positive and then it fires. And you can imagine wherever this is happening in the brain, you're getting all these nerves firing, and this is what we call an electrical storm. And this might be where you feel the lightheadedness or you get your bell rung and you're uneven. That's kind of what happens in the first few seconds to minutes. Beyond that, the electrical storm kind of ends, and we deal now with what we have a little chart here. So this squiggly part is just going to be where the electrical storm occurs. But because these chemicals go all over the place, that causes a huge decrease in energy flow. And that's where you'll see on the side here, this is supposed to say fuel. Your fuel levels within the nerve cells start to really deteriorate or decrease a lot. And in that case, you start to get more symptoms, or the symptoms start to prolong, or some new symptoms might even start up. And sometimes you might not have symptoms at all until a day or two later. And this usually has to do with the fuel in the nerve cell starting to decrease. Once again, not really concerned about that, because as you see over time, this will actually come back up into normal levels, and that could be anywhere from 1 to 4 weeks. What we're concerned about with the concussion is if we make a mistake and we send you back too early, or you just want to send your athlete back, or you want to go back too early, and you get hit again, well, your energy levels actually drop down even lower, and they can get to as low as 60% of what's supposed to be in that cell. If that happens, you actually can run into what's called nerve cell death. That you can't recover from. So the concussion itself, usually the fuel only drops to about 80% and then you fully recover. But if we send you back and you get hit again, this is what we're afraid of. And Ryan's going to talk about Rowan's Law in a second, and you're going to understand why we think this is pretty important. And it's not to scare anybody, but it's something that we're trying to make sure we avoid. So we're trying to avoid that second impact. And everybody tends to take, and we'll talk about this a little bit more, everybody tends to look at symptoms, but symptoms have nothing to do with these fuel levels. Symptoms can go away in I guess, up to 15 days, sometimes up to 8 days. That's the majority of the people, all their symptoms are gone at that point. But you can still have functions in the brain. So this dotted line here represents roughly where symptoms are typically gone, and that's the halfway mark. You can still have other parts of the brain that are not recovering, and that's where we're going to get into why we do baseline testing on the next video. But this, I just kind of wanted to give you guys a quick glimpse of what's going on with the concussion and why we get a little bit concerned when people don't want to fully recover, or they think they're fully recovered when their symptoms are gone, which is not necessarily the case. So Ryan's going to carry on a little bit more, I think, with Rowan's Law.
Yeah.
Okay.
So Rowan's Law is something that Parliament has now introduced in Ontario, and it's just been passed. We're just waiting on an implementation date. But essentially what happened was that a student in Ottawa, a rugby student named Rowan, she received a concussion. She thought she was okay, but was kind of aware that she was probably concussed. And then she went out, played again, and in that game that she played a second time, she got another concussion, which was second impact syndrome, and she actually was pronounced dead. So now Parliament is taking that very seriously, and all minor leagues, minor sports organizations, are required to implement a concussion protocol where trainers and athletes alike are all aware of what's going on and how a concussion is managed and treated.
Yeah, so I think here at Cheerforce, because this is something Ryan and I were talking about before, Cheerforce has actually been doing this for 4 years.
Yeah.
Okay, so before Rowan's Law ever came out, Frank and Chris and Trish and Sharon, they were actually ahead of the game, and they've been instituting this protocol, how to return, how to get it diagnosed, to make sure the athletes are safe. And like I said, so they've been, I guess, quite a bit ahead of the game. So we've kind of just given you a little bit of a glimpse of things here. We're going to go on to talk about what is a baseline, what is a concussion baseline, and I'll probably throw out a third and fourth video on how do we manage them, and some of the big questions and concerns we get here, because we're not trying to upset any parents. And this definitely, I'll just be a little bit blunt here, it's not a money grab. We don't make very much money from this. For me, it's more peace of mind. For Ryan, it's more peace of mind. And it also helps determine what the rehab needs to be. So we'll see you guys in the next video.